And so once again, thank you all for joining us tonight. It's my pleasure to introduce our speaker, Dr. Candice Todd. Dr. Candice Todd is a naturopathic doctor and co-chair of the Black Scientist Task Force. Dr. Todd completed her honors Bachelor of Health Sciences degree at Western University, after which she went on to graduate from the Canadian College of Naturopathic Medicine. Dr. Todd's practice is rooted in health optimization and disease prevention. She utilizes evidence-based naturopathy practical medical care, which prioritizes treating the root cause of health concerns to help her patients feel and perform at their best.
Most part. All right, guys. So thank you for having me today, and thank you for attending this webinar or talk today. Today, we'll be talking about boosting your immune health. And I think that in light of the pandemic and, what we've been through in the last couple of years, people are often looking for a more holistic approach to supporting their overall well-being, but their immune health in particular. Supporting your immune health can help you be more robust when it comes to fighting infection in general, but it's also something that can, if you do choose to get vaccinated and things like that, help your vaccines to work better. You need a healthy immune system to have your vaccines work well for you. So either way, having a supported immune system is really important. And often people are looking for, again, those natural approaches to supporting immune health because that's often our go-to. It is, when my family is from Jamaica and when there's a cough or a cold or anything sort of looming, the go-to is always, some sort of concoction. There's usually some ginger in there, some turmeric, some rum often. So we're always sort of looking for that natural concoction that will help to support us in the meantime. So we're probably not going to talk a lot about rum today, but, we're going to get into, the real sort of tried and true evidence-based ways that we can support our immune health. So next slide, please. Okay, so first I wanted to sort of talk about some of the key sort of players when it comes to cold and flu season. So we're sort of at the tail end of cold and flu season, but it's important to know that you can get these things all year round. It's just that we're more vulnerable to getting them during the fall and winter months. So all of these viruses are things that can lead to infections of the upper respiratory tract. They are transmitted through droplets, and essentially what it requires for people to get infected are people. So you need to be around somebody, and though there is a transfer of what are called respiratory droplets that can potentially infect somebody else. So this happens when people are coughing in your vicinity, sneezing around you, or even just talking to you. So the current players that we're sort of looking to fend against right now that are heightened during cold and flu season are the flu, COVID-19. We had sort of an upswing of RSV, or respiratory syncytial virus, as well as the common cold. And a lot of these things can look very similar. So you'll have really common symptoms, fever for most of them. Fatigue is definitely one of them that you'll have a lot. You can get runny nose, and you can even get runny nose for things like allergies, sore throat, cough, headaches, muscle soreness. So all of these can look very similar. One of the sort of notable differences when it comes to COVID-19 is that you might have that loss of taste or smell. So, sort of distinguishing between the three can come through testing. You could do a COVID test, but essentially what we want to do is help to fight off the virus, whatever virus it is. And there are different viruses that cause each of these things. So for the flu, it's influenza. For COVID-19, it's SARS-CoV-2. For RSV, it's RSV. And for the common cold, it's typically rhinovirus. Not sure if I said this already, but RSV typically affects children and the elderly in a more severe way. So that's what we were seeing sort of in the tail end of last year, that we were having a big upswing of children who were getting hospitalized for RSV. So the takeaway here is that all of these are existing. You can get them at any time. And what we want to do is to, one, prevent how we get them. So, just knowing that they are transmitted through respiratory means, through droplets, we can do the things necessary to try to prevent that. So those are things like physical distancing, things we've all become all too aware of now. Physical distancing, hand hygiene, so making sure that you're washing your hands, sneezing into your arm if you are sneezing, and mask wearing if you find that's appropriate as well. Next slide. Okay, so there are some things that make us particularly vulnerable to getting these respiratory illnesses. And again, what I was saying was that people are sort of the number one thing that need to happen in order for the right sort of conditions to exist. So people being around each other. So this can look like dense or crowded living accommodations. So you are more at risk for getting any of these respiratory diseases or respiratory illnesses if you're living in dense living situations or multi-generational homes. So, there are some people who live with their parents and live with their kids, and, potentially other family members are living there too. So that sort of being around crowded populations allows more opportunity for transmission. Working on the front line is also one of those things that increases our vulnerability. Taking public transit is I know I personally take public transit to get to work, and I was getting sick like every 2 weeks, and that had to be it, because otherwise I'm pretty like solo, but was getting very, not very sick, but sick very often. Children in daycare, for any parents out there, that your kids they're not, physically distancing, they're not washing their hands whenever they're playing with their friends and things like that. And there is huge opportunity there to bring something home. And, your kids in daycare, especially, they're sick every week. And then having pre-existing chronic disease can also make these things worse. So what that means is that having chronic disease, cardiovascular disease, diabetes, and other sort of like metabolic diseases can make it so that there is an increased risk of hospitalization or death, or like more advanced illness if you do get one of these respiratory illnesses. Next slide. All right, so today we'll be talking about your immune system and ways that we can support it. So these aren't, what we're talking about today is maybe a more robust conversation about your immune health and just, keeping healthy in general. What we're not specifically talking about today are like, herbs to treat COVID, or herbs to, what's going to get rid of, or what's going to stop me from getting COVID, or what's going to stop me from getting the flu. The answer to that is nothing. But what we want to do is have your body prepared for that. Okay, so your immune system. Your immune system is essentially a complex network of organs, cells, proteins that defend your body against foreign invaders while protecting your own cells. So it has the ability to recognize what's foreign to the body versus what is not foreign to the body and protect that. We have what is called innate and adaptive immunity. So innate immunity is a more sort of general immunity. It is non-specific. It's like your body recognizes that this is not, this is a foreign entity to the body and works to sort of neutralize that pathogen and get rid of it. Adaptive immunity is the process of creating antibodies to fight off specific invaders. So adaptive immunity happens once we are infected with something and your body starts to create antibodies to that something, so that in the future we are more protected against that invader. And then symptoms equal your immune system is working. So a lot of the time people just associate symptoms with like sickness, but a lot of the symptoms that we experience are actually signs that our immune system is working for us. So for example, you get a runny nose, and that is your body producing increased mucus so that it can trap foreign invaders and, have you expel it. So, ideally you want to blow your nose as opposed to sort of, sucking it in so that we can get those foreign entities out. You cough when there's a throat irritation to, again, get those foreign invaders out. And a fever is essentially your body heating up so that it can kill off foreign invaders again. So symptoms are signs that your immune system is working for you. Next slide. All right, so here's where I wanted to get a little bit more interactive. It's maybe the only question I have for you guys, but I want you to tell me in the chat what you think the top 3 or even 1 influence on your immune health is. And not all at once, guys. Okay, Melissa said diet, great. Nutrition, exercise, sleep, good. Good, any more thoughts? We're gonna get into them. Pressure, stress, great. So yeah, so pressure is stress, great. Sport and diet, awesome. Yeah. Oh, did someone have a question?
So you can go ahead and type your thoughts into the chat.
Yes, environment. All right, guys. So we're sort of right on track here. So let's get into it. So definitely there are additional impacts or influences on your immune health, but the top 3 are in fact sleep. So great for the people who said sleep, stress, amazing, and vitamin D deficiency is actually another huge one, and it's one that impacts. Oh, so if everyone can mute.
COVID, not bad. Amy, can you mute them?
Yep.
Yeah, perfect. So, okay, thanks. Thanks, Amy. So again, sleep, stress, and vitamin D deficiency. And vitamin D deficiency is something that we'll get into in a couple of minutes, but it is something that really impacts people living in the Northern Hemisphere. It's people living in Canada. All right, so next slide. Okay, so sleep. So thanks guys for participating in that. You guys are all right on track. So that's awesome. And obviously nutrition is one of those things that can be supportive to your immune system. And we'll talk about that as well. Okay, so sleep. So sleep is really important for your immune health. There are many links to poor sleep quality and having a higher susceptibility to illness. So people who haven't gotten good quality sleep are more likely to get sick with a common cold, for example, and with influenza. So those are studies that have been done, but we can sort of generalize that to infections in general. Poor sleep quality also links you to a number of cardiovascular diseases and increased risk of stroke and heart attack. So those are some sort of more cardiovascular or chronic conditions that can make your outcomes overall worse in terms of health. So when we're talking about sleep quality, the quantity, so the amount of sleep that you get and the quality of sleep that you get are important for your life, for your lifestyle, for your health, and your immune health in particular. So what we want to get essentially is 7 to 9 hours of uninterrupted sleep that follows a circadian pattern. So ideally, the sort of like the Cadillac of sleep is getting 7 to 9 hours, sleeping throughout the night, falling asleep within 15 to 30 minutes, and sleeping in the nighttime. So that circadian pattern thing means that we sleep during the night as opposed to during the daytime hours. So we want to sleep when it's dark, essentially. And that has been proven to be the most restorative when it comes to overall health and can help to prevent or support your immune system. So when your body is out of that pattern or is not getting the best sleep or the best quality of sleep, what can happen is that is seen as a stress to the body. And we're going to talk about stress in a second, but that stress can create low-grade inflammation. It can also, when there is perceived stress, your body wants to focus on the stress and turn off other things. So we're going to talk about that right now. So again, sleep quality and quantity are important. You want to fall asleep within 15 to 30 minutes. So anyone who's, up on their phone at night, on TikTok, if you're staring at the wall, then that's something you want to do. There's something that you want to do to improve your sleep quality. And then if you find that you're waking up multiple times throughout the night or even once throughout the night and it's hard to fall back asleep, then you'll want to do some things to improve your sleep as well. And we're not talking about that today, but there are a number of ways naturopaths can actually support you to get better quality sleep. Next slide. All right, stress. So if anyone has heard of the fight or flight response, that's what's essentially happening in terms of the impact on your immune system. So prolonged psychological stress suppresses immune function. Again, like I was saying, when there is stress or perceived stress, your body wants to prioritize that stress and focusing on that stress because it's seen as like an impending, we have to deal with this right now. And it's going to turn off your rest, your rest and digest, or your digestive system, as well as your immune system. So it's not prioritizing those things because there is this sort of impending stressor that the body wants to deal with. And this goes back to sort of like caveman times, prehistoric times, but we are not experiencing stress in the same way as we were during those prehistoric or caveman times. The stress that we have now is just sort of like constantly there. So we're not giving our bodies the opportunity to have supported immune systems if we're not engaging in things related to self-care. So management or stress management techniques. So some of the things that I like to do and that I like to prescribe to my patients are meditation. Some people can't meditate. I totally understand that. It's hard to sort of calm the brain down and stop thinking in that way. That's why I like guided meditations, and you can find a lot on YouTube. Prayer is meditative as well. Exercise, so sometimes sort of getting that stress out in the form of exercise is really therapeutic for people. Journaling and yoga, and also remaining socially connected. And one of the things that we have experienced during this pandemic is a lot of isolation. We have, had to quarantine for so long. We were, away from work. Some people are still away from work and working from home. Some people love it. But there are some people who do sort of thrive when they're engaging socially. And studies show that social engagement is important for overall health, and that isolation is linked to things like depression and anxiety. Deep breathing is another one that's not listed here, but it is one that is sort of quick that people can do to, if you're in a stressful situation and you need to sort of calm down. I do what's called box breathing, where you do an inhale for 4 counts, you hold that for 4 counts, you exhale for 4 counts, and hold it for 4 counts. So you're sort of like inhaling, holding, exhaling, holding. And that can help to bring your body back into what's called a parasympathetic state, which is the opposite of the sympathetic or fight or flight state that we're in with stress. So those are all sort of great self-care techniques that you can engage in on your own. And I always recommend seeing a licensed counselor or therapist if you have the means to do so. And if you're looking for, for many people, as a Black woman, counseling or therapy is often, there's also often a stigma when it comes to mental health in general, but it is super helpful and can really help you to sort of get into some of the reasons for your stressors, or the deep-seated or deep-rooted reasons for your stressors. So I always recommend considering therapy and as a useful tool if you're looking for someone that sort of you want to experience, you want to have had sort of lived experiences that are similar to yours. You can go to Psychology Today and you can actually filter so that it is, as a Black woman, there are people who serve Black communities, for example. So you can filter in that way, or South Asian communities, or however you want to do it. So I do find that that's a helpful tool if you're looking for someone who has sort of similar lived experiences to you, because trust in the therapeutic relationship is really important when it comes to therapy as well. So stress is the second one. And then next slide. Vitamin D deficiency. So when it came to COVID, what we were finding was that people with vitamin D deficiency were more likely to test positive for COVID-19. And as naturopaths, we've known the importance of vitamin D to your immune system, since well, obviously when I was in school. I'm not going to say the beginning of time, but it's always been sort of a reoccurring theme when we are helping to manage or support immune health. Vitamin D is always one of those things that we want to check for, and we want to supplement reasonably for. So vitamin D is connected to immune health and as metabolic health as well. And then that metabolic health comes into play when we're talking about chronic disease and the severity of disease that you can experience if you do get infected with one of these viruses. It's also important to know that people of color are more inclined to be vitamin D deficient, and that is because melanin actually blocks the UVB rays from the sun, which help in the production of vitamin D. So vitamin D is not something we regularly get from food or the food that we eat. It actually comes mostly from the sun. So that's why it's important to, when we can, get outside, spend some time in nature, because we're getting that added benefit of vitamin D. Now, living in Canada, I know that you all know that we live in the dark for at least 6 months of the year. So we're actually not getting the appropriate sunlight to create sufficient amounts of vitamin D. So that's another sort of block that can create a scenario of vitamin D deficiency. So I always recommend that people get baseline vitamin D testing. It's actually not something that is covered by OHIP. So if you do, it might be an out-of-pocket cost, but it is a really sort of like big bang for your buck vitamin that is important in immune health, mood support, bone health, skin, hair, nails. So getting your baseline vitamin D checked is something that you can do with your family doctor or with your naturopath. Sometimes it's actually covered through your naturopathic benefits if you do have coverage for that. So important to get your vitamin D tested. We are notoriously deficient, and it is something that is really crucial for immune health. All right, next slide. Okay, so now we're going to get into some of the nutritional support for immune health. And it's not just, again, what you eat. I think that what I want people to get out of this session is that supporting your immune health is not about, that one herb or that one root or that one, spoon of honey that you take to, that's going to help you ward off everything. It's actually a collective and a holistic number of things that you do to make sure that you're well-tuned and that your immune health is maintained and robust. So now we're going to talk about nutrition. So there are a number of specific vitamins and minerals that are important for immune health, and we're going to get into how we can get some of those nutritionally. So next slide. Okay, so nutrient sources for immune support. So the big 4 vitamins that I'd say are amazing building blocks for your immune system are actually antioxidants, but they are, again, and they're all actually fat-soluble vitamins. So vitamin A, vitamin C, vitamin E, and except for vitamin C, sorry. So vitamin A, vitamin C, vitamin E, and vitamin D are really important building blocks for your immune system. So, again, your immune system is a number of different, includes a number of different cellular processes, your gut microbiome, a number of different organs that help to produce the that help you to produce white blood cells or your immune cells, as well as other sort of defenses to foreign pathogen. So someone had a question, can supplement be used for building? I'm not sure what building means. So if you mean building your immune health, then yes. So these are so supplements. So, okay, I understand the question. Sorry. So yes, you can supplement with these things, but it's important to get things in the right therapeutic amount. So that was another thing that I wanted to talk about as well. So I'm going to go through this slide really quickly. So vitamin A you get from cod liver oil, really great source. You get it from eggs, orange and yellow veggies and fruits. So, things like carrots, papaya, orange peppers, they're going to have vitamin A in there. Vitamin C you get from citrus fruits, strawberries, red peppers, papaya again, vitamin E, and guava for vitamin C. So if anyone's using sort of like their own indigenous fruits or things that are from back home, guava is a great source of vitamin C. Vitamin E you get from sunflower seeds, almonds, greens, and pumpkin. And then vitamin D, the best source is from sunshine, but it's also fortified in a number of different products, meaning it's added into there. And then for minerals, zinc and selenium are really important, and these are often from animal sources, but there is a good amount of zinc in pumpkin seeds and oysters if you're fancy like that. Selenium you can find in beef, pork, chicken, turkey, fish, and eggs. So the question is, can you supplement? So yes, I'd say that eating these foods will give you sort of a general amount of them. So, it's not to say that, I would say eating these is important for like general immune support and general health in general. If there's something more acute going on, we may need to supplement. So we may need these key nutrients in higher amounts. And that's why it's important, again, to work with a professional, so a naturopath, a nutritionist potentially, or a dietitian who can help direct you with supplementation. So you want to be taking things in therapeutic amounts, because you won't always get the therapeutic amount if there's something going on through food alone. So yes, supplementation is an excellent way to help to be supportive when there is a therapeutic need for them. So I hope that makes sense. All right, next slide. Okay, so in general, again, you want to consume nutrient-dense foods, whole plant foods like fruits, vegetables, nuts, seeds, and legumes. They are rich in the nutrients that I just mentioned, most of them, as well as antioxidants, which are, again, building blocks for immune cells. They also help to protect against metabolic disease. So, what you'll see is like that chronic disease or metabolic disease goes hand in hand with worser outcomes, and being healthier, eating healthier can protect you against those worser outcomes. You also want to incorporate more anti-inflammatory and antioxidant rich herbs like ginger and turmeric. So those things are really great for just in general supporting your immune system again. But then if you want to be doing something for something specific, and I'll get into the more specifics a little bit later, but for inflammation, let's say turmeric is a really great anti-inflammatory root or herb, but we want to be taking that again in a therapeutic amount that will help to control inflammation in a specific way. So if somebody has, for example, I treat a lot of like hormonal conditions, and I get a lot of patients who experience cramping before their menstrual periods. So if we want to manage that pain and inflammation that happens before your period, you want to supplement with turmeric in an intentional way so that it's going to help relieve those symptoms. It's sometimes not enough just to eat the food. All right, next slide.
And there is a question in the chat if you want to address that now, because it's on this topic.
Okay, yeah, so this is a great question. Does taking excess ginger and turmeric have any side effects? So yes, so that's also why you work with a regulated professional, because not everything is for everyone. So yes, as one example, both ginger and turmeric can increase your bleeding risk. So, in one way that is good, like it thins out the blood is what I'm trying to say. So in one way that's good if you do experience like cardiovascular diseases and you want to help to thin the blood a little bit so that it can continue to circulate well. But if you're somebody who's on blood thinners, for example, taking ginger, taking turmeric might be something that is contraindicated for you or something that you shouldn't do because it can cause you to have a bleeding risk. So yes, there are limits to everything, even in the supplement world. So, working with, again, a licensed professional will allow you to see these things. So they're going to do an assessment with you and make sure that you're, if you're on any medications, for example, that there's no interactions with any of the supplements that are recommended for you. So that's a really great question. Okay. We also want to limit sugar intake. So again, it is not about just that one thing you can take or, what's that one thing that I can do to improve my immune system. Again, it's a holistic thing. So we want to eat nutrient-dense foods. We want to eat specific foods that can help to boost those particular vitamins and minerals, but we also want to limit sugar intake because it's going to have negative impacts on our immune health. So high sugar consumption increases inflammation overall and impairs immune function. And added sugars and refined carbs contribute disproportionately, again, to overweight and obesity, which again impacts immune health. So, studies have found that in an environment with high sugar intake, your white blood cells, so certain white blood cells have been less aggressive at destroying pathogen. And white blood cells are some of the cells that make up your immune system. So there is a correlation with high sugar intake and poor immune function. So we want to limit that. Sugar and carbohydrate intake. And when I talk about sugar, I'm really talking about the processed and refined sugars. So, I'm not saying don't eat any fruit or anything like that. Fruit has, and eating the whole fruit is really beneficial in terms of getting you additional fiber that will actually sort of blunt the sugar spiking effects that you would have if you were just having the fruit juice alone, actually. So not saying fruit, I'm talking more about processed and refined foods and added sugars in our foods. All right, next. We also
And there was one question in the chat, just wondering if honey can be used as a substitute for sugar.
So, yeah, so the question is, can honey be used as a substitute for sugar? So the answer is yes, in terms of nutrient density. You're going to get more nutrients from honey, and honey does actually have antimicrobial effects. But at the end of the day, it is still sugar. So when we look at like the nutrition of honey, the only nutrient that it's going to have in there are carbohydrates and the and sugar is the carbohydrate that is giving it that carbohydrate number, if that makes sense. So yes, you can substitute honey, but just know that you're not lowering your sugar intake if you're having honey. You're just increasing the nutrients that you're getting from a sugary thing. So not saying that it's bad, but everything in moderation. What kind of fruits do we need to take daily to boost our immune system? So if you go, again, you want to like eat the rainbow. Again, orange and yellow fruits and veggies are really great for vitamin A. Citrus fruits, really great for vitamin C. You get vitamin E from a number of different greens, and then zinc and selenium, a little bit harder to get minerals from fruits and vegetables, but you'll find those in more like nuts and seeds and animal products. Okay, and then somebody asked, is it true turmeric activates with black pepper? So that is true. So black pepper does help with, in general, turmeric on its own and turmeric as a supplement is not readily absorbed in the gut. And, when we're talking about it being readily absorbed, we're really talking about the constituents that help it to be anti-inflammatory or antiviral or whatever it is. So it is true that having a supplement or having your turmeric with black pepper can help it with its absorption. And then when you look at your supplement formulas, if you are having a supplement, for example, you do want to ensure that there's black pepper on the label. And if that's not there, that it's in a liposomal form, potentially, where it's more or better absorbed. And again, that is something that a qualified professional can help you with. So literally, that is why like naturopaths go to school, for example, so that we learn all of these things. Sometimes it's hard with supplements because you know that turmeric's good for you, and then you see the supplement and it has turmeric, but it might not be in its best or most absorbable form. So if you do need someone to help you with that and sort of figure that out, then it's always great to speak to a licensed professional. So the short answer is yes, black pepper does help with the absorption of turmeric and its active constituents. All right, so now we're getting into, I guess, some of the things that people are here for. So some of the herbal supports that we can use to, oh, did I talk about alcohol? I didn't. Okay, sorry. I read the question and didn't talk about alcohol intake. So alcohol is one of those things that, during the pandemic, and I have said this many, many times, but, the gyms were closed, but the LCBO was open. So we've had a lot more higher intake of alcohol in general across the population. And that, is associated with many poor outcomes when it comes to health, and immune health is one of them. So there's a long association of excessive alcohol intake and increased susceptibility to infections. And I don't know if anyone has seen that the guidelines now around sort of appropriate alcohol use or what's considered high have changed drastically. And now I believe it's 1 to 2 drinks a week is a normal consumption of alcohol. And I know many people who have in excess of that. So now what's considered excess or heavy drinking is more than 1 to 2 drinks a week. So there is, again, association with alcohol use, and you're more likely to get infections in general. It disrupts the immune pathways, or the pathways by which your immune system defends the body or fights off pathogen. It also alters the gut microbiome. And I'm sure many of you have heard that the gut microbiome is one of our levels of defense. So the microbiome is essentially the number of microbes that make up or exist in our gut. And they exist actually all over our body. And a lot are helpful, but we, especially in sort of an environment where we're not treating it well, can create imbalances in the gut microbiome, which can lead to digestive problems and more systemic problems overall. So that includes even mood changes and skin issues and things like that. So alcohol can definitely alter the balance of the gut microbiome. It also contributes to that added sugar intake, which again lowers your immune response, and then can have detrimental effects on your organs. So many of your organs are involved in creating your immune cells, and alcohol has impacts on every single organ in the body. So, and the impact is not a good one. So limit your alcohol intake. All right, next slide. So now we're going to get into natural remedies for acute respiratory illnesses and illness prevention. So essentially what that means is, what can I take acutely when I do have an infection, and then what can I take to prevent illness overall, or to support my immune system. Okay, so when I'm treating a patient, and this is not treatment advice, none of this should be taken as treatment advice for you. This is just some helpful information. And if you do want more specific guidance around any of this, again, I encourage you to reach out to a licensed professional. I'm going to say that over and over again today. So just be prepared for it. So acute management. So we want to incorporate high doses of those key nutrients. Again, what I call ACEs, and zinc and vitamin D. So ACEs are your vitamin A, C, E, S is your selenium, and then vitamin D is like it's in its own separate category. So in terms of what are high doses, again, speak to a healthcare practitioner, but for vitamin D, for example, it's going to be in excess or higher than a typical dose, which is 1,000 IUs. That's like the sort of standard dose of vitamin D for adults. So it's definitely going to be higher than that. And again, that's where testing comes in. It's important to know your baseline so that you can know how to dose things appropriately. When it comes to herbal supports, and there's so many herbal sort of remedies to help to manage infections. But these are some of the, I guess, more popular ones that most people know about. So elderberry, really great for kids as well. It's also called sambucus, and that's its Latin name, but great for kids because they like the taste of it. And in particular, it is great for the flu virus. And to help you to reduce your upper respiratory tract symptoms overall. So what people have found, or what studies have found, is that it helps to reduce overall symptoms when it comes to upper respiratory tract infections. So helps you to recover a little bit more easier. Echinacea, great for the flu as well. Oil of oregano, for anyone who has had oil of oregano, not great tasting, but great for RSV. Garlic And again, you want to get these things in therapeutic amounts. So when I'm talking about these herbs, I'm not talking about the food necessarily. I'm talking about a herbal preparation, whether that's a tincture or a supplement or in pill form. So garlic is great for the common cold, or it's good for it's good against rhinovirus. And then ginger is good for influenza and RSV. So when you're taking these things, again, not talking about the food, talking about a therapeutic dose of the herb, which has a lot to do with its constituents, or like the active ingredient in them. So this is just to show you also that a lot of, we're going to go a little bit over time, but this is also just to show you that, you know, a lot goes into herbs. There is a lot, yes, they're really great, and, you know, they're natural, but there is a lot that goes into getting therapeutic benefits from them. All right, next slide. Herbal support for illness prevention. So this is now more for like long-term, like how do I support my immune system? Like what can I sort of take as a herb to help my immune system stay resilient? So Astragalus, that is a root, but really great for as an adaptogen. So an adaptogen is something that helps your body to manage stress well. So Astragalus is a great one. Again, Echinacea is good for, again, sort of long-term immune support. A herb called Codonopsis, as well as Siberian ginseng. And one of my favorite go-tos, and you'll find this now actually in a lot of, you know, there's a lot of like powders and things like that, functional powders that have mushrooms in them. And mushrooms are, so not like shrooms, but, or not just like, you know, not just the common mushroom that you get at the grocery store, but there are a number of different types of mushrooms that have really great therapeutic benefits. And that includes turkey tail, chaga, maitake, reishi, and cordyceps. So you'll find a lot of these in powdered preparations that you can mix into things like coffee or tea or smoothies. So these are sort of great things that you can take over the long term to help your immune system stay resilient. And just a couple more slides. I'm going to go into COVID specifically for a second, because there are a lot of people who have been experiencing long COVID symptoms. And what I have found is a common theme with long COVID is inflammation. So inflammation in a number of different areas. And again, long COVID is sort of lingering symptoms that you have after you've had COVID. So neural inflammation. So this is inflammation in the nerves, and it can look like things like brain fog, memory and sleep issues. There's a number of people who have been experiencing that. As well as cardiovascular inflammation and joint and muscle inflammation. So inflammation is sort of a common theme. So when we're treating, we want to do what we can to manage that inflammation. So that's what we'll talk about in the next slide. Next slide. Okay, long COVID management. So, and these are things that I've been doing in practice, but we want to incorporate, again, immune support as discussed. So things to help to support your immune system. But in terms of nutraceuticals or specific supplements, there are a few that I've found to be effective. So curcumin is the Latin name for turmeric. N-Acetyl Cysteine, or NAC, which is a precursor to what is called glutathione, which is your master antioxidant. So all of these things, or all of these supplements, have really great anti-inflammatory and antioxidant power. So N-Acetyl Cysteine, as well as something called quercetin and nebulized glutathione. So nebulized just means that it's been aerosolized. And I find that with patients who have had shortness of breath following COVID, they have a lot of lung inflammation. Nebulized glutathione is really great. It's not something, though, you want to do with somebody who has asthma. So it's actually contraindicated in asthma because it can be irritating to the airway and make symptoms worse. Again, you want to see a licensed naturopathic doctor or functional medicine doctor for additional support and more direction around these nutraceuticals as well. And then if anyone wants to do that, next slide. So there's a number of different resources to find a naturopathic doctor. The College of Naturopaths, you can check their registry for somebody in your area. The Ontario Association of Naturopathic Doctors and the Canadian Association of Naturopathic Doctors all have registries where you could sort of check to see if there's a naturopath in your area that you can connect with. And also the Naturopathic College, which has a clinic called the Robert Shad Naturopathic Clinic. They have actually subsidized naturopathic care. So the appointments are more cost effective, but you'll be treated by the students of the college who are supervised by licensed professionals. So that's another option as well. Because I just have a lot of people who ask, this isn't a presentation about go find a naturopath, but I do have a lot of people who are asking for some of the outreach people that they work with as well. So that is one way for them to get connected with a naturopath. And then again, I have like a little disclaimer that the contents, so next slide, the contents of this presentation should not be taken as medical advice for you. Seek services of a licensed healthcare provider like a naturopathic doctor, or a functional medicine practitioner for additional support when implementing changes into your health and wellness regime. And really that is something I have to say so that, you know, it is so that you know that it's important to seek personalized care. That's the real key here. Again, not everything is for everyone. And last but not least, if you have any questions, you can feel free to ask them now. And then if you want to connect with me at all, you can connect with me on Instagram at dr.candice.nd. And I hope that you guys enjoyed that. We're a little bit over, but if you have any questions, I would love to hear them.